Good morning. I'm Lindsay, and I'm going to be sharing with you my my practicum experience with the Aboriginal Coalition and Homelessness Society, or ACEH. And to begin, I would like to acknowledge the Wasanich and Lekwungen peoples whose traditional homelands I've been honored to live, work, learn, and play. I'd also like to acknowledge the Lekwungen, Malahat, Pachidat, Skainu, Tsuk, and Wasanich peoples whose ancestral lands the ACEH gathers and operates. So a little bit about myself and the perspective that I brought to this practicum experience. I'm Lindsay. I use she, her pronouns. I'm a white settler, first generation Canadian, born to Scottish parents. My paternal family has ties to Ireland and the Tayside region of Scotland, whereas my maternal side is from the Fife region of Scotland, which is located right across the River Tay. I have been honored and grateful to be living on Lekwungen territories for nearly 10 years now, but I was born and raised in Chilliwack on the ancestral homelands of the Stolo peoples, meaning people of the river. I have experience working in harm reduction and supportive housing, so I was familiar with ACEH already as a community partner and really excited that I got the opportunity to do my practicum with them. So the Aboriginal Coalition and Homelessness Society is an Indigenous-led nonprofit organization dedicated to providing culturally supportive housing solutions for Indigenous people experiencing homelessness and who may be living with complex mental health and substance use challenges. They operate under a dual model of housing care, which combines both the philosophy of decolonized harm reduction with culturally supportive housing initiatives to support land-based culture, language, and healing. What stood out to me about their work is that it's guided by the voices of Indigenous elders and the Indigenous street family who share their lived experiences and perspectives to inform future developments. And they stand out as a community leader because their work is emphasized by love and providing multiple pathways to recovery and healing. So throughout my practicum with ACEH, one of my biggest challenges was navigating my role as a settler in an Indigenous-led organization. I wanted to ensure that I was contributing respectfully, without imposing my preconceived biases or assumptions, and also ensuring that the work that I was contributing reflected the goals of the organization. So I practiced ongoing self-reflexivity and had open dialogue with my supervisor, which was really critical to my learning and my experience there and helped ground the focus of my work. For the bulk of my practicum, I conducted an environmental scan on Indigenous-led best practices for relapse prevention, as well as I was invited by the director of ACEH to incorporate some Western relapse prevention models. And these knowledges gathered will inform the programmatic development of the Wellness House, which is a new housing initiative opening in 2026. Some of the PHSP skills I developed include the application of diverse perspectives on health and well-being, particularly through the implementation of both Indigenous and Western approaches to research. I supported community-based advocacy through a collaborative project with a peer colleague who was a former family member, and I'll refer to her as C throughout this presentation. Family member, just to clarify, is the term used as opposed to using more colonial terms such as client or participant. They use family members for people who are accessing services at ACEH. But she provided some qualitative data through sharing lived experiences with recovery and helped identify and assess the needs of the community. I also supported the evaluation of health programs through participation in an end of fiscal year meeting with ACEH directors and managers, and we collaborated through roundtable discussions to plan for improvements within the organization. And finally, I developed cultural humility by participating in the cultural protocol of self-locating and introductions with staff and family members. Some PHSP values that I developed throughout this experience include Indigenous knowledges and the right to self-determination, which was strengthened through participating in a cultural in-service event with ACEH staff. During this event, a knowledge keeper shared with us some Coast Salish art, stories, medicine making, and getting to participate this really showed the vital importance of these land-based programs for helping connect family members to their culture and support healing. Throughout my practicum, I also supported community-based research, which was contributed through the inclusion of lived and living experiences throughout the research. And I built meaningful partnerships by engaging respectfully with the ACEH community and family members, coming from a place of love and non-judgment, and participating in cultural expectations and protocols. I want to next reflect on some of the PHSP knowledge areas through the lens of ACEH's work. So ACEH recognizes colonization as a social determinant that has a significant impact on the health and well-being of the Indigenous street family and Indigenous peoples across the island and globally. They aim to reduce health inequities through their dual model of housing care, restoring Indigenous health through sovereignty, self-determination, and empowerment. And the success of ACEH is defined through effective teamwork, building respectful relationships with community partners, and through the value and integration of diverse Indigenous voices and perspectives, including elders and knowledge keepers. Throughout my practicum and in my future work, I intend to adhere to TRC's call to action number 22. To summarize, it calls upon the Canadian healthcare system to recognize the value of Indigenous knowledges and healing practices. And as a public healthcare worker, I commit to continue to advocate for Indigenous-led community initiatives and elder roles within services, and will continue to recognize ACEH as a community leader. To conclude, I would like to acknowledge the impactful experience of taking part in the self-locating protocols. In the end of fiscal year meeting, particularly sharing about one another's ancestry and what brought us to our work, instantly created a sense of connection, and it made the space feel really welcoming, gave me the confidence to participate and collaborate, even in a room full of very experienced and intelligent people, which is normally intimidating, especially as a student. But I also learned about the possibilities of my role as a settler in an Indigenous organization, and learned that my perspectives were invited and valued within that context and with mutual respect. And lastly, a highlight was getting the opportunity to meet and work with C and hearing her recovery journey, which took her through from the streets not too long ago through a managed alcohol program with ACEH, and then now she's working as a part of the organization as a peer worker. And it was really inspiring to work with her and meet her, and truly shows that the goals of ACEH and the way that they lead with love and through culture truly works. Thank you, everyone, especially to my supervisor, Dr. Megan Brown, to C, the ACEH director, Fran Jan Hunt Janucci, and Dr. Margaret Skaya, and student peers for guiding my learning and providing insightful feedback throughout this experience. Thanks, everyone, for listening.